Well, it depends, as I would say, from the risk factor. So, average patient which has no family history for colon cancer in parents or first-degree relatives, the recommendation starts at 50. If there's any other problem, we definitely, recommend the colonoscopy earlier. So, I mean, if the patient had blood per rectum, for example, like before age 50, unless the patient is very young and we are very comfortable that the bleeding comes from the from the anus, we don't recommend it. But if the patient is already like 40s and there's blood per rectum, I think it's probably safe to do it, even if you have a reason in the anorectal area for bleeding, but still you want to make sure that you're not missing something else, and that is reasonable. Otherwise, if there's somebody who has a first-degree relative that had colon or rectal cancer, we usually recommend to have the first colonoscopy 10 years before the diagnosis of that relative. So, if your dad had colon or rectal cancer at age 50, it's probably the recommendation for that patient to have it at 40. Even if without any other problem, without any changing bowel habits or without blood per rectum, is the safest thing is to do it 10 years earlier. That's what we think.